Hello and welcome to Safety Tavern's video on blood-borne pathogens. Now, we could take a look at a video and I'll show you a little bit of it. Let's take a look at that now.
OSHA blood-borne pathogen training. This course addresses the occupational exposure to blood-borne pathogens standard.
Okay, I've had enough of that. This is why we don't have these videos. Let's do some actual training and talking at a normal human speed. Let's get into it.
What are blood-borne pathogens? Blood-borne pathogens are microorganisms such as viruses or bacteria that are carried in blood and can cause diseases in people. Blood-borne pathogens include malaria. According to the big giant Google box, malaria is carried by mosquitoes, and that is a really hard thing for us to figure out if you got malaria from work or from home or from wherever. The best we can do on a job site is, as an employer, make sure you're doing everything you can to keep the mosquitoes down. As a GC, make sure you're doing everything to keep the mosquitoes down. Don't let any standing water sit around. Do the best you can. This is a really hard one. Syphilis. The main cause of syphilis is sexual activity. So don't have sex on the job sites. Brucellosis, which is contact with animals. Like if you're working at like a dairy farm or you're working at a zoo. For this video, we're going to focus on Hep B, Hep C, and HIV. For Hep B, see, overall, we're going to wrap this up by stating that these little guys, they get into your blood. They take a ride in your bloodstream until they find your liver. The incubation period, and this is Hep B that we're focusing on, the incubation period is roughly 30 to 180 days. Initial symptoms can include mild like flu symptoms, fatigue, possible stomach pain, loss of appetite, nausea. These symptoms can last roughly from 3 to 10 days, right? So again, incubation means it hasn't shown symptoms yet. So it incubates and then you start having these symptoms and they'll last about 3 to 10 days. And then you get some serious nasty symptoms like jaundice and dark urine. And when I say dark urine, I don't mean orange, I mean brown and getting into red. Hepatitis B is a virus that causes infection and inflammation of the liver. Is transmitted primarily through blood-to-blood contact. It can lead to serious conditions such as psoriasis and liver cancer. Can survive in dried blood for up to 7 days. Did you hear me? Dried blood for up to 7 days. Hepatitis B is one of the primary reasons why we have to do training. So when you cut your hand on the job site and you drip blood, understand, you have now contaminated the job site and every place that blood touched for up to 7 days. There is no cure or specific treatment for hepatitis B. Many people develop antibodies to fight these diseases, which may prevent future infection. Again, we can't assume that you have developed these antibodies. Vaccines are available to those whose jobs require them to be exposed to blood-borne pathogens, which, if you're watching this video, then chances are you're not one of those people whose job requires you to be exposed to it. Typically, the vaccines are a series of 3 shots and then blood work to determine if the vaccine took. A licensed healthcare provider will determine the course of action that needs to be taken for each employee. This is for any employees that we believe may have come into contact with it, as well as the previously mentioned employees that would require them to be exposed to. Vaccines are provided by the company. Employees who decline to take the vaccine must sign a declination form, meaning I don't want to take the vaccine, so I have to sign a form. Those employees can come back at any time and request a vaccine later on. Hepatitis B is bad. Don't get hepatitis B. Hepatitis C. Hepatitis C is the disease of the liver caused by Hep C virus. Hepatitis C is spread by contact with the blood of someone who has hepatitis C. And if you were notified that you received blood from a donor who later tested positive for Hep C, have ever injected illegal drugs, you may be at risk for even years and years and years ago. Received a blood transfusion or solid organ transplant before July 1992. Received a blood product for clotting problems produced before 1987, have ever been on long-term kidney dialysis, have evidence of liver disease, persistently abnormal ALT levels. There is no vaccine for Hep C. Hepatitis C is bad. Don't get hepatitis C. Next, we move into HIV and the AIDS. AIDS, or the Acquired Immune Deficiency Syndrome, is a disease caused by a virus called the human immunodeficiency virus. It may be years before AIDS actually develops. Right? So it starts out as HIV and then it moves into being AIDS. HIV attacks the body's immune system, weakening it so that it cannot fight other deadly diseases. AIDS is a fatal disease, and while treatment for it is improving, there is no known cure. The HIV virus is very fragile and will not survive very long outside of the human body. It is primarily of concern to employees providing first aid or medical care in situations involving fresh blood or other potentially infectious materials. Symptoms: fever, fatigue and headache, swollen lymph nodes, achy muscles and joint pain, skin rash, nausea, vomiting and diarrhea, sore throat and dry cough, night sweats. But here's the problem. These symptoms aren't 1, 2, 3. They're not in order. These symptoms are all happening at once. So while you're sweating your butt off in bed, you can't really sleep very well because you're having fatigue and headache. You're nauseous. You get up to go to the bathroom because you're about to vomit. You have diarrhea. It's a horrible situation all at once. HIV and the AIDS are bad. Do not get HIV and the AIDS. Bloodborne pathogens are transmitted through contact with infected human blood and other body fluids such as semen, vaginal secretions, brain and spine fluid, joint fluid, lung fluid, heart fluid, baby fluid, and saliva with visible blood in a dental setting. These are some of the body fluids that you can get it from. In an occupational setting, transmission is by needle sticks and sharps, punctures, or cuts. That is the main method of transmission. Mucous membranes and non-intact skin exposure to contaminated blood or other potentially infectious materials. Unbroken skin forms an impervious barrier against bloodborne pathogens. However, infected blood can enter your system through open sores, cuts, abrasion, acne, any sort of damaged or broken skin such as sunburns or blisters. So if there's a break in your skin, you are potentially at risk for contracting it, right? You still need to have the exposure, but that is how it gets into your body. Bloodborne pathogens may also be transmitted through the mucous membranes of the eyes, nose, and mouth. Meaning if a drop of nasty blood drips into your eyeball, yes, now you have exposure. Bloodborne pathogen transmissions. Not all the bloodborne pathogens carry the same risk of infection from an occupational exposure. Frequency in patient population, the ability of the virus to survive on environmental surfaces, and the amount of virus present in the body fluid all impact the risk of acquiring infection if exposed. The following table demonstrates infection risk from lacerations and needle punctures, exposure to Hep B, Hep C, and HIV. Again, if you look here, I'm not going to read all the parts per million and all that, but if I think of it this way, if I get injected with a drop of dirty blood of hepatitis B, I have a 30% chance of contracting hepatitis B. Hep C, I have a 3% chance. HIV, I have a 0.3%. That 30% chance of Hep B and the 7 days that it can survive as dried blood, that is why we have to have this class. Warning labels must be placed on containers of regulated waste, refrigerators, and freezers containing blood or other potentially infectious materials, and other containers used to store, transport, or ship blood or other potentially infectious materials. What is regulated waste? Any liquid or semi-liquid blood or other potentially infectious materials, contaminated items that would release blood or other potentially infectious materials in a liquid or semi-liquid state if compressed, items that are caked with dried blood or other potentially infectious materials. If you have any questions with either of these, talk to the competent person for your company for bloodborne pathogens. Again, we're going to look at the OSHA hierarchy of controls, eliminate the hazards, substitute, replace the hazards, substitution, engineering controls, isolate people from the hazards, administrative controls, change the way we work, and then finally it's PPE. These controls reduce the employee exposure by either removing the hazard or isolating the hazard. Administrative controls. These controls reduce the likelihood of exposure by altering how a task is performed. Examples include wash hands after removing gloves and as soon as possible after exposure, do not bend or break sharps, no food or smoking in work areas, personal protective equipment. Specialized clothing or equipment worn by employees for protection against infectious materials. Again, this would be if we expect you to handle it. Must be properly cleaned, laundered, repaired, and disposed of at no cost to the employees. Must be removed when leaving area or upon contamination. Again, talk to the competent person for your company for bloodborne pathogens if you have any questions about these. How should any type of exposure be handled? Again, these are going to all be general rules of thumb. Your company may have a specific rule or extra rules or different steps. Look at your safety manual for your company or talk to your competent person for your company. That being said, universal precautions, an approach to infectious control in which all human blood and most body fluids are treated as infectious materials. What this is saying is that we treat everybody like they are radioactive, like their blood has got hepatitis B, C, gonorrhea, syphilis, every STD possible is in their blood. Every single person. I don't care if it's your brother. And yes, we have many crews where we have family members working on the same crew. Yep, their blood is hot. While you're at work, their blood is treated like it's radioactive. If they get a cut, we treat it like it's radioactive. That is called a universal precaution. Types of PPE are face shields, barrier masks, gloves, aprons. Post-exposure follow-up, knowing the right steps to take after the exposure incident is critical in reducing the likelihood of acquiring a bloodborne pathogen. Immediately after any exposure incident, wash the exposed area with soap and water. If the exposure involves eyes, you should flush with tap water. Report the incident to your supervisor and complete an incident report as is appropriate with your company manual. Report the incident to your company competent person. And follow any instructions given for treatment, especially by your doctor. Your site's exposure control plan covers exposure control, the facilities where the vaccinations and the testing is performed, post-exposure incident evaluations, exposure incident investigations, and the declination form for hepatitis B. Review your company's exposure control plan.
I hope this video finds you well, and see you in the next one.